Hi guys, today I'll be talking about the accommodation to the point of undue hardship. So the law sets limitations on the obligation an employer has in regards to accommodating an employee within Canada, and the limits of an employer are to provide reasonable accommodation and or accommodation to the point of undue hardship. So there's little to no difference between the two concepts. Undue hardship is when an organization expresses issues regarding cost, available funding, or health and safety requirements. Therefore, an organization must be accommodative an employee up until they begin to express these organizational problems. Depending on the province, certain provincial human rights codes may limit the factors that may be considered as a demonstration of undue hardship. Occasionally, other aspects may be taken into account, such as employee morale and collective agreement between union and employer. So it's important for everyone to remain up to date with the particular criteria for the jurisdiction, as they are always changing, and there is no dollar limit on the cost an organization spends accommodating an employee that defines it undue hardship. The test of an organization is whether the cost is too high, that it will start to threaten the viability of the employer's organization or drastically change the nature of the business. So this means that the larger the corporation is, such as Coca-Cola, they could technically spend upwards of $100 million on accommodating a single employee, and it would not be considered undue hardship. Therefore, they would still have to pay the fees to support the accommodation of an ill or injured employee. Many employers have the notion that accommodation mental health issues can be highly costly. So, however, as we have learned in this class, most accommodations by company cost less than $500, and they're very effective. So letting a prolonged issue to fix itself only creates a lot bigger issues. Health and safety risks by employees should be taken very seriously by employers. So in some cases, there may be a health and safety risk that cannot be accommodated. So if somebody is on medication, such as a painkiller, it's often prescribed by the doctor that the patient does not operate a motor vehicle. Therefore, it would be a health and safety risk to allow them to continue to drive a jump truck if they are on painkillers. So in cases like this, accommodating the employee may be very difficult due to the health and safety risk. However, before health and safety can be used as a justification for treating an employee differently, refusing to hire somebody or even refusing to accommodate an employee must be shown that the employer is incapable of accommodating the employee. So an employer may consider the activity or requirement that the employee is unable to perform is actually essential for the job. So if it is not the essential aspect of the job and activities, then there's no reason not to accommodate the employee. So how does one determine if the employer has met the duty to accommodate? When determining if an employer has met the obligations to accommodate, one must research the processes that the employer has taken with the employee within the actual accommodating given/receiving process. So the particular criteria that is considered by courts during determination of the employer's fulfillment of obligation to accommodate include the following. So did the employer make attempt to either find alternative or modified accommodations to meet the requirements of the employee in a non-discriminatory manner? And what are the reasons that the alternative or modified accommodations were not used? And could the employer meet the objectives in a less discriminatory manner? So is the policy, standard, or procedure also necessary for this employer to accomplish these objectives? Did all parties work together in the search for alternatives, including unions and professional associates? And is the cost of accommodation a huge impact on the organization that it's so great that it impacts the nature of the employer's regular organizational performance? So when a person's accommodating an employee with mental health disorders, there's likely to be much confusion from all parties. Particularly patients with psychosocial challenges are commonly unaware of their right to be accommodated. So as a result, persons may feel as if they do not want or need to be informed of their employer of their certain circumstances. So that may aid the workplace by accommodating them. So to combat this situation, organizations can express how accepting they are by creating programs to aid people who are afraid to speak about a personal issue due to the fear of being discriminated against. So organizations must in turn create an inclusive workplace environment in response to meeting the needs of persons with mental health disorders and addiction problems, as well as to promote their essential participation to the corporation. And lastly, the future of health, mental health, and accommodation. So as the years go on, the development of mental health and accommodation continues to increase. Many pieces of literature suggest that mental health and accommodation have already undergone a great deal of development and remodeling. Although the development behind the accommodation mental health in workplace has occurred positively, there's always more that the organization and the employer can do to ensure that the future of accommodations of mental health in the workplace are more efficient and effective. So a future model for the accommodation towards employees suffering mental health issues would be the multi-system, multi-level, and multi-dimensional system. Simply having one level of the organization actively working on an accommodation program is simply not enough. So I believe that having a multi-level and multi-dimensional accommodation available would greatly increase the time periods associated with the return to work process. I also believe that the current transition from traditional medical approaches towards focusing on wellness and ability instead of focusing strictly on the disability and the future of mental health and workplace accommodations would greatly increase employer-driven programs. So this would ensure that the organization greatly cares for all injured and ill employees. Having more employer-driven program demonstrates to the organization and employees directly that the organization has a positive attitude towards ill and injured employees. So having a more accepting and inviting environment in the workplace will display the message to the employer that it is more than willing to help in particular cases regarding the employee dealing with mental health issues. So, therefore, there are a few changes that the organization can make to ensure that employees with mental health illness are capable of receiving the best accommodation possible. So the employer should create awareness campaigns within the organization surrounding mental health. The public awareness campaigns will hopefully shift the negative attitudes towards a positive attitude, and overall the stigma behind the mental health illness should be eliminated within the organizational environment. And this would provide the best accommodation towards employees suffering with mental health. So the change of policies and legislations towards the accommodation of employees with mental health disorders would greatly impact the procedures taken by organizations. So as a result of the change of policies and legislation, the behavior and attitude taken by employees when dealing with an employee with mental health affairs would be noticeably non-identical. So therefore, I will pass it off to Ching to finish the end of our presentation. Thank you very much.